Waist circumference is a significant predictor of mortality and morbidity. The risk of cardiovascular complications increases as waist circumference increases. This association is found in men and women alike, regardless of age or ethnicity. It is therefore crucial that healthcare professionals treat waist circumference as a vital sign to be measured. This training activity gives you a step-by-step description of how to precisely measure a patient's waist circumference. This technique will help you reliably measure waist circumference on a periodic basis, as well as detect any changes in the amount of abdominal fat. Before you start, we recommend the use of a measuring tape with a spring handle to help you control the pressure exerted on the patient's abdomen. This exercise is divided into 10 easy steps. Step 1. Clear the abdominal region of all clothing or accessories to remove any pressure on the abdomen. Men may remove their top garment. Women may tuck their top garment under their bra. If your patient is wearing tight or restrictive clothing, be sure to have them unlatch their belt or loosen their pants and lower the garment sufficiently to remove any pressure from the abdomen. Failure to loosen restrictive clothing may compress or push more adipose tissue into the area of measurement, resulting in an inaccurate measure. It may also make it difficult to accurately palpate the iliac crest. Having your patient change into loose-fitting clothing with an elastic or non-restricted waistband is best. Step 2. Ask the patient to stand with their feet shoulder-width apart and have them cross their arms over their chest in a relaxed manner. Step 3. Kneel down to the right of the patient in order to measure their waist circumference. Step 4. Palpate the patient's hips to locate the top of the iliac crest as shown in the picture. Step 5. Once you have located the uppermost border of the iliac crest, draw a horizontal line with a pen or washable marker. Your mark should be made at the midline of the body, halfway between the patient's back and the patient's abdomen. Step 6. To work comfortably around your patient, you may choose to wrap the tape around their legs and then move it up. Place the measuring tape horizontally around the patient's abdomen. Keep the tape horizontal from left to right and from back to front. A mirror is recommended to facilitate this procedure. Step 7. Align the bottom edge of your tape with your marked point. This will ensure the tape is positioned at the uppermost part of the iliac crest. Step 8. It is recommended to use a measuring tape with a spring handle, such as the Gulick measuring tape, in order to control the pressure exerted on the patient's abdomen. Gently tighten the tape around your patient's abdomen without depressing the skin. Tip: when using a measuring tape with a spring handle, pull the end of the tensioning mechanism until the calibration point is just visible. Step 9. Ask your patient to relax and breathe normally. Make sure that the patient does not tighten their abdominal muscles when the measurement is being taken. To help your patient relax, engage them in conversation or have them take 2 or 3 normal breaths before you take the measurement. Step 10. Measure from the 0 line of the tape to the nearest millimeter at the end of a normal expiration,